Hello, and thank you very much for tuning in to the St. Paul School Open Enrollment presentation. Just to start off, your open enrollment will begin on February the 10th and run through February 21st of 2020. So you will have 2 weeks to complete your open enrollment for the April 1st, 2020 to March 31st, 2021 plan year. We're excited to welcome you to our 18th annual open enrollment, celebrating 18 years of service to private Florida education employees. Shown here on the screen is a collage of all of our current membership. So we thank you very much for participating in the IQVIA Benefits platform. Here's just a sneak peek of what we're going to review today. On the left, we're going to review what's new for April 2020. We're going to talk about a low increase to medical premiums, a new IQVIA offering available with AFLAC benefits, some Rally program enhancements, introducing a new physician results form for biometrics, a small increase to the flexible spending limit, a new Symetra voluntary life offering, dependent verification, and we're going to let you know how you can enter the raffle to be entered into the open enrollment sweepstakes. We're also going to review some of the same great benefits which will continue for the 2020 plan year. We have a lot of great resources to help you break through that barrier and get you better access to care, which we will review at length. We're also going to review some of the medical plans that are in existence, your prescription plan, your behavioral health plan, dental, vision, and your basic life and disability, and we will wrap up with some open enrollment housekeeping items. So as we talked about last year, IQVIA is a self-funded medical plan. What this means is that IQVIA pays all the claims that are processed by the medical, pharmacy, and behavioral health benefit managers. We collect your premiums if you have our plan, and we use your premium dollars for the exclusive benefit of our members, and we only pay for the benefits that you're receiving. So all the claims that are being processed by Blue Cross, Optum, and Aetna, they are all just paying the bill, they're paying the claim and then sending IQVIA the larger bill. So the plans that IQVIA has for you are created specifically and designed by educators for educators. We meet monthly in our offices in Orlando to review all the plans, really hash them out and talk about changes that we can make as well as enhancements. And we think we've got a few good ones for you this year, most notably in the form of the Rally incentive. IQVIA does invest in a long-term culture of well-being. You can be the best version of yourself. That's very, very important because we want you to take care of yourself so, you know, it will ultimately come out better on the claims side. So with your good use of the plan, we're pleased to bring you, our members, a low premium increase for the 2020-2021 plan year. New this year, IQVIA is excited to introduce our newest brand partner, which is Group AFLAC. The new Group AFLAC plans will include critical illness, hospital indemnity, a low option and a high option, as well as an accident plan. The new group plans will provide better benefits at a lower cost in most cases, and we're offering guaranteed issue, which means that there's no medical questions to be asked. All prior plans through your Colonial rep will no longer be offered through a payroll deduction, but don't worry, portability information was mailed to you if you'd like to keep that prior plan. We think we do have some pretty good competitive plans to offer you, so just take a close look before you make your final decision. First, we're going to cover the Group AFLAC Critical Illness Plan. Some of the coverages included are listed on the left-hand side of the screen: cancer, heart attack, sudden cardiac arrest, coronary artery bypass, major organ transplant, bone marrow transplant, kidney failure, and stroke. This benefit will pay a lump sum cash benefit to you upon diagnosis of any of these coverages that are included. It pays in addition to other insurance coverage. And we're also offering guarantee issued up to $30,000 for the employee, and then up to $15,000 for any eligible spouse. The spouse election cannot exceed 50% of the employee election, so the employee must first make the election in order for the spouse to be eligible. Children are automatically covered by the employee election up until the age of 26, so there is not an additional election that's required for children. The good thing about all of these AFLAC plans is they are all portable and you can take them with you if you change jobs or retire. We hope that you do not need the critical illness this year, and you're not, you get the white flag and you're not diagnosed with any of these ailments that are listed on the screen. But if you are in that sweet situation where you don't need to cash in on your critical illness, we don't want you to forget about the $50 annual health screening, which would still apply. So just keep that in mind. We are also offering a group AFLAC hospital indemnity plan. The coverages include hospital admission or confinement due to an accident or illness. This also pays a lump sum cash benefit to you, in addition to other insurance coverage. The premiums can be payroll deducted or will be payroll deducted, and there will be no medical questions asked. The major differences between the high and the low plan do come in the form of the admission benefit. If you are admitted to the hospital under the high plan, you will receive $1,000. And if you are admitted to the hospital under the low plan, you will receive $500. The confinement and intensive care is still $100 per day under both. An example that we've shown on the screen for you is for pregnancy or delivery, probably one of the more common reasons why an employee would elect a hospital indemnity plan. So under the high option, you will get $1,000 for the admission. And let's say you are confined for 3 days for the delivery of a baby. That's an additional $300. So the total payment for you under the high plan would be $1,300. We also have an example of the low plan totaling $800 for that low plan. Group AFLAC is also offering an accident plan. So nobody really wants an accident. That's why they call it an accident. It cannot be planned for. And with accidents, sometimes large financial burdens come along with that. So if you're ever in a situation where you are in an accident and you do need additional funds, an accident plan can be a great resource. It can help assist covering ambulance rides, emergency room visits, fractures, second or third degree burns, any lacerations. There's an example of benefits shown on the screen here, and they pay a cash benefit to you in certain situations. So it's important that you review the summary of benefits so you can get a full picture of what will be covered in the event that you are in one of these accident situations. Again, we hope that you do not need to utilize this benefit during this coming plan year because nobody wants to be in an accident. But if you don't use it, there's still that $50 annual health screening benefit, which will apply. Moving on to Blue Rewards powered by Rally program enhancements for this year. We heard some noise last year about how the program more so catered to the older population or the more seasoned population or people that need a lot more medical tests than others. So we've revamped the program a little bit, and we decided to boost up some of the things that everybody can take advantage of. So the wellness exam has been increased from $25 to $60. The biometric screening has also been increased to $40. And then we threw in a few extra on-site campus events, so you can now earn $10 a piece up to $70 for a total of 7 on-site events. Preventive exams have been grouped together, so the very first claim that's processed in the form of a PSA, a colonoscopy, or mammogram will earn you an additional $50. An IQVIA Cares qualified medication change is still $50. And we still have a bunch of coin opportunities for you in the form of missions, city challenges, teledoc, registration, tobacco attestation, and clinical rewards. The Rally survey is still the gatekeeper this year, so don't forget about doing that survey after the first of the plan year so you can gain access to all the dollars that you're going to earn in the coming year. We did hear some noise last year. A few people were wondering what the coins could be used for. The coins are really fun if you watch for those flash sales that come through. And another good thing to point out, and just kind of a feel-good fact, is that IQVIA members donated more than 4 million coins to charity last year. The charities rotate quarterly within Raleigh, so if you keep your eye out, you can donate your coins as well. We're really excited to be rolling out the new physician results form. There's no more finger pricks or additional blood draws, so starting in April, IQVIA members can get credit for biometric screening just by visiting your own physician. You'll log into the same member portal that you did previously for a biometric screening or to visit the patient service center for an appointment in order to gain access to that biometric incentive credit. You'll still visit that same website. There will just be a new option for a physician's results form. Step 2 is that you'll simply download the form. It will contain a unique barcode for the employee or eligible spouse. So it's important that you don't make copies of this form and don't share it with your friends, because this form is unique to you as a member and is printed straight from your employee profile. Step 3 is just completing the annual wellness exam with your physician, which includes blood work. So if you go in for your annual wellness exam and your doctor runs routine blood work, which often happens, then your doctor can just fill out the form next to section 3 in what's circled in red. And then step 4 is submitting the form. So your physician can fax the form to Quest Diagnostics directly, but we're just encouraging all members to request a copy of the signed form, not only for your records, but in case the office staff loses the form or forgets to upload it, or it doesn't make it to Quest, the Quest portal, you have it in your hands so you can fax it or upload it on your own. Just a few reminders about Raleigh rewards that are still out there. There's still rewards for the clinical rewards for chronic conditions. So if you've been diagnosed with one of the conditions that is included in the clinical rewards program, your home screen within Raleigh might just look a little bit different. What this is doing is providing you additional educational opportunities and educational materials based on the condition that you've been diagnosed with. If you follow along and you read the articles or you engage with a health coach, you will be rewarded with some additional coins. The city challenges and private sweepstakes are still available as well. City challenges are probably the most fun because there is a $50 Amazon gift card given away every 14 days. So every time you enter a challenge and sync your device and you reach one of those challenge milestones, you're automatically entered to win. There's private sweepstakes available also for completing the survey, participating in the missions and challenges, and for doing other options or other items that are found within the Raleigh site. So we wanted to put together a full picture of the value of the improvement for the new Raleigh program. I'm sure you all are familiar with Emma, so we have put Emma into our own scenario, and by the next open enrollment, we hope that this will be her story. Emma was able to download the Blue Cross Blue Shield mobile app and was able to locate a Blue Distinction total care provider. She was able to receive an annual physical at her Blue Distinction total care provider, and it was always free because everything done at those providers is always free. And she was able to earn $60 for that wellness exam. Her primary care physician also submitted the physician results form and earned her an additional $40 for the biometrics. So just from that single doctor's appointment, Emma has already earned $100. At work, Emma participated in 5 on-site events totaling $50, and she's really hoping for 2 more since we did increase those on-site events to 7. During a recent doctor's appointment, Emma was diagnosed as diabetic. She connected with a Blue Cross Blue Shield health coach through the clinical reward program and got control of her condition and actually learned some in the process. So she's on her way to a healthier path. At this time next year, Emma has already earned 150 Raleigh Rewards dollars that can be redeemed in the form of a gift card. and she has donated 8,000 coins to various rally charities. Keeping in mind that Emma has not done anything out of the norm. She did not contact IQVIA Cares for a qualified medication change, and she did not receive a mammogram or colonoscopy for those additional funds. So the sky is the limit with the new rally plan. We just want to keep in mind that the new flexible spending election is required each year. So a healthcare flexible spending account or a dependent care flexible spending account, these are mandatory elections. They do not roll over. The difference between these two, I will go through them briefly. They are both funded by you as the employee. They are both deducted throughout the plan year. The main difference is the healthcare flexible spending account is 1, available for immediate use, and 2, can only be used for healthcare expenses for you and your eligible dependents. The IRS did increase the limit this year on the healthcare flexible spending account to $2,750. On the dependent care side, these are deposited each pay period into an account, which then you can use for eligible daycare expenses, such as daycare, aftercare, gap camps, summer camps, stuff like that. One important note that you should be aware of is that the dependent care flexible spending account can only be used for children under the age of 13. So if you have a dependent that's turning 13 mid-year, just be mindful that the money that you put aside into this account can only be used until their 13th birthday. The IRS household limit for the dependent care flexible spending account is $5,000. Both of these accounts are subject to the use it or lose it rule, and they do not have an annual carryover. So when you're budgeting for these two options, please plan wisely. We want to introduce some income protection benefits that you already have in your benefits portal or in your benefits portfolio. These income protection benefits are already provided to you by St. Paul School. So all benefits eligible employees receive basic life and AD&D, short-term disability, and long-term disability at no cost to you. The basic life and AD&D, short-term and long-term that you already have are as outlined on the screen. What is brand new for the April 1st, 2020 plan year is an option for you to make an additional election for some supplemental or voluntary employee life and voluntary life options. During this open enrollment only, you have the opportunity to make first-time elections for this voluntary life insurance coverage with no medical questions if it's below the guarantee issue amount. And this, again, is for first-time elections only. So everyone at St. Paul's School, if you'd like some additional life insurance, now is the time. Voluntary employee life and voluntary employee AD&D options are up to in increments of $10,000 to a maximum of $500,000 or 5 times your salary, whichever is less. EOI will only be required for elections in excess of $150,000, and AD&D does not require EOI. So for this open enrollment, you have the opportunity to elect an additional $150,000 of voluntary employee life with no medical questions. Please keep in mind that age reductions apply beginning at the age of 65, and in order to purchase life insurance for your spouse or your child, you must first purchase voluntary coverage for yourself. Any elections that are pending for EOI must be approved by Symetra before they go into place. Next, we're going to review the spouse life and the child life options. The spouse value can be purchased up to 50% of the employee amount in increments of $5,000, not to exceed $250,000. You can purchase up to the guarantee issue amount this open enrollment with no medical questions, and for spouse life, that guarantee issue amount is $50,000. Child life is also available and can be purchased in a flat amount of $10,000. Again, this is if you do not currently have voluntary life and you are interested in increasing your life insurance for yourself and your family members, this open enrollment is the time to do it. So keep that in mind, and just note that all Symetra voluntary benefits do require an active enrollment. It's always important to keep up-to-date beneficiary information. So in the unfortunate event of your death, you want to make sure that your loved ones have that financial support that they need. So when you're stepping through the process, just be sure that you have the legal name, contact information, and the percentage of benefits in the system do total 100%. Keep in mind, if you're electing to have a minor under the age of 18, it might be important for you to establish a proxy or a trust in their name. If evidence of insurability is needed, so if you go above those guarantee issued amounts that we've discussed, you will get a pop-up reminder within the system that lets you know that there is an additional step that is required. When you complete your open enrollment process, there will be a pop-up screen that leads you to a Symetra portal. There will be several questions that must be answered right at the time of your enrollment, when your enrollment is finalized. This cannot be done later. So do your best to answer the questions as they're outlined. This will be the only time that you have to complete this evidence of insurability process. And if Symetra has any additional questions based on how you complete the evidence of insurability, single sign-on connection, or any of the EOI paperwork that is through the portal, they can always reach out to you. So where are you going to do all these enrollments that I keep talking about? You can visit icubabenefits.org, and during the open enrollment period, you're free to update all of your benefits for the April 1st, 2020 to March 31st, 2021 plan year. These benefits will remain in place until next plan year, as stipulated by the IRS. However, you may only make changes if you have a qualified life event during the plan year. So log into your employee portal at icubabenefits.org. At the top of your home screen, you will have a button that says start your enrollment. And then from there, you'll just click through the enrollment and follow the steps as indicated on the side of your screen. When you complete the process, you can view, print, or email your enrollment to yourself, which we highly encourage. And don't forget that if you are flagged to complete that evidence of insurability process, it will pop up as soon as you finalize your enrollment. If you do choose to ignore Emma in the beginning of your enrollment, but then you decide that, hey, I would actually like her recommendation, she will always be there for you to ask an additional question to, and she is available within the enrollment portal. Dependent verification is always an important step. We just want to make sure that all of the dependents enrolled in the ICUBA plan are in fact eligible. If you learn that you are covering someone that is not eligible for the ICUBA plan, you can drop them during open enrollment, and their coverage will terminate as of March 31st. Keep in mind, I know everyone watching reads all of the fine print before you submit your enrollment, but if you miss this paragraph, you are certifying that all dependents that you've elected coverage for are in fact yours. So just a reminder of who an eligible dependent is. We have it shown on the screen here, and it is also available in your portal. Just a reminder also, a child is a dependent until the end of the calendar year in which they reach age 26, and any dependents over the age of 26 who are considered disabled and incapable of self-support because of a disability can remain on the plan as long as you provide documentation. The open enrollment sweepstakes that we're hosting, it's very simple to enter into these sweepstakes. You simply have to log into icubabenefits.org and update or confirm your personal phone number and personal email address under the employee information screen. Once you finalize your enrollment process, you will automatically be entered to win. So just make sure that all of your personal information in there is as accurate as the new benefits for the new plan year. ICUBA tries really hard to improve access by eliminating barriers to care. So it's really important to be an educated healthcare consumer and understand how your plan pays for covered services. This is extra important before you're sitting in the doctor's office. The IQVIA plans are specifically designed to remove barriers to care by offering plans where the deductible only applies to major services. So what does that mean? The first way that IQVIA breaks down barriers to care is with our special single sign-on section. So within the IQVIA portal, you can visit under the rotating banner, you'll see My Carrier Account. Upon clicking on these for the very first time, you will be prompted to complete a username and password. But after that, you can just log into IQVIAbenefits.org and click directly in and view your MasterCard account balances, your prescriptions at Optum, your Blue Cross Blue Shield information, including your explanation of benefits, and Aetna, Humana, and IMED are also available. This is a breakdown of some of the things that we have at no cost to you, some of the items that don't apply to the deductible, and then some of those major services. This is part of our education tool just to help you better understand the program. On the far left, all of the items that are no cost access to you. These are all items that should always be 100% completely free. So any visits to your Blue Distinction Total Care primary care provider, bone mineral dentistry scan, bone mineral scans, colonoscopies, immunizations, mammograms, medically necessary labs performed at Quest Diagnostics. Any of these items listed on the left are at no cost. The column in the middle is not subject to the deductible. So these items will probably have a copay or a coinsurance associated with them. However, they should never be subject to the deductible. So items like advanced imaging, chiropractic services, emergency transportation, physicals, prescription drugs, specialist visits, all of these items in the middle are never subject to your deductible. And then on the far right side, these are the major services that will always apply to your deductible. The durable medical equipment, home health care, all hospital expenses, inpatient mental health and substance abuse, private nursing, and other items that require a little bit more extensive treatment are pretty much typically always subject to your deductible. All of these items can be found outlined on your benefits of summary from Blue Cross Blue Shield. The Surgery Plus benefit comes paired with the medical plan. This plan was introduced last year and it was by far our most popular benefit of the year. Surgery Plus will pair you with the top quality elite surgeon of excellence. The Surgery Plus surgeons are licensed, board certified, fellowship trained, and have been screened for malpractice sanctions and criminal records. They cover hundreds of medically necessary but non-emergent surgeries, and their surgical procedures. There's a snapshot of a few key ones that they perform here in the bottom left of the corner of the screen. Paired with the Surgery Plus benefit is a huge financial incentive to you. If you choose to get a medically necessary but non-emergent surgery through Surgery Plus, your deductible and coinsurance will be waived. So the actual surgical procedure is at no cost to you. There's also a travel benefit that is included if it's applicable. So if they do ask you to travel to another location far away from where you live, well, not too far, but kind of far away from where you live, they will cover any travel expenses, including per diem for food, a gas allowance, and even a hotel allowance if it's required. So if you have questions about a non-emergent but medically necessary surgery, we encourage you to call a care advocate for more information. They do provide a full service concierge approach, so they will first locate the best fitting surgeon of excellence for you. Once you decide which surgeon you'd like to proceed with, they will schedule appointments, coordinate medical record transfers, and then schedule follow-ups as necessary. Just a reminder that Teladoc is still available. This was a very popular benefit, and it's still a very popular benefit at only a $5 copay. So if you are stuck at work, you don't have time for a doctor's office visit, your doctor's unavailable, or you're on vacation or a business trip, or it's simply just a weekend, we encourage you to take advantage of the Teladoc offering. Members must establish an account prior to seeking treatment, so it's always important to make sure that you've already established your account. The Teladoc service is only for the more minor illnesses. Some of the top diagnoses are shown here on the screen, stuff like sinus problems, bronchitis, allergies, upper respiratory infections, or nasal congestion, something that you can easily describe to a doctor or physician over the phone. They are permitted to write prescriptions as needed. However, they are not allowed to write prescriptions for controlled substances or other lifestyle drugs. So the more minor illness, or the more minor medications that come with the more minor diagnoses, are why you would call Teladoc, are always good. IQVIA Cares Pharmacist Advocate Program. This program was introduced a few years ago, and so far they have helped numerous members with their prescription needs. So we just wanted to ask a few questions. We're wondering if you have any side effects from a new medication that you're taking, or you just have questions about that new medication. Have you recently been denied at the pharmacy for prior authorization and you misplaced your letter that Optum mailed to you? Were you recently told that you needed to try step therapy before you can take a certain drug and you're not sure why? Do you, or like me, do you just want to learn how you can save money? You can easily switch to a generic in most cases just to save money in another way. These are all great reasons why you would call the IQVIA Cares Pharmacist Advocate Program. They are available Monday through Friday from 9 to 5. They are real pharmacists that will really advocate for you. They will actually get on the phone with your doctor's office and the insurance company if it's warranted to provide you real solutions. Able to is still a really great benefit we just want to remind you about. It is a condition management program with free weekly sessions. So if you're suffering from one of the health or life situations or conditions on the left-hand side of the screen, we really think that you should give this program a try. You choose whether you want to do video conferencing or telephonic appointments, and you meet twice a week, once with a therapist and once with a behavior coach. The program lasts 8 weeks long and consists of 16 sessions. This program is meant to help you identify goals and set an action plan to help manage one of the conditions that's listed on the screen. And we've heard really, really great things about this program. Just a reminder, if you receive a call from Blue Cross Blue Shield, Optum, IQVIA Cares, or Aetna, they're calling because they care. We have partnered with these trained health advisors and registered nurses so they can provide you tools and education and advocate for you to help you manage your chronic health condition. So you have been identified through a process with one of our brand partners, and that's what's sparking the outreach to you. So if you have a few minutes, please, we encourage you to take the phone call and hear what they have to say. They'd really just like to assist you with setting goals and help you understand your doctor's treatment plan, and just to support you along the way, because managing a chronic health condition can be a little overwhelming at times. A few reminders here for you. I'm sure everyone is already aware, but the free visits to a Blue Distinction Total Care provider are always the way to go. So if you're in the market for a new physician, we really encourage you to locate a Blue Distinction Total Care. All medically necessary services performed at a family practice, internal medicine, or pediatrician office with the designation of Blue Distinction Total Care are always free. On the right side of the screen, we touch on the Care Connected and how Care Connected is always in your corner. This is the customer service phone number on the back of your Blue Cross Blue Shield ID card. So the Care Connected team at Blue Cross Blue Shield can help you with claims questions, can assist with billing, can help you find one of those special Blue Distinction Total Care providers, and can also connect you with a health coach or a life coach if you should need that avenue also. The Blue Cross Blue Shield mobile app was rolled out last year, and we've heard some really great things about it. So just a reminder, if you don't already have the Blue Cross Blue Shield My Health Toolkit mobile app on your phone, we really encourage that you download it. You can do everything within the mobile app, or most everything that you can from a computer. It does have security features such as a Touch ID or facial recognition for your login, so you don't have to remember your password every time. It does also display real-time data. So if you're in your doctor's office, you can easily pull up your last EOB right there in the doctor's office. Another cool feature with the My Health Toolkit app is once you're logged in, you can save your ID card directly to the home page. So if you're in a doctor's office and you don't have cell phone service, you can still access your ID card without logging in. The Employee Assistance Program is available to everyone within your institution. You do not need to elect the IQVIA benefits or even be benefits eligible. So even part-time or just sometime workers over there can always contact the Employee Assistance Program for help. They offer support for a multitude of reasons in addition to emotional, life, legal, and financial. Although the ones outlined on the screen are the most popular reasons why members call the EAP. So for the emotional support, this offers up to 6 sessions per issue per year for each member of your household. So if you have other members living with you, maybe an aunt or a niece or a nephew or elderly parents, they all have access to these 6 free sessions per issue per year. They also cover life. So if you need access to retail, entertainment, travel, or even fitness discounts, they can help you with that as well. The legal and financial services are also super popular within the EAP. If you are in a situation where you've had your ID theft or just want to learn about prevention, or need access to legal documents, they have a wide array of legal documents to choose from, including a living will. And with tax season coming up, everybody could use some financial consultation. So just remember that the EAP is also available to help, and every call made to the EAP is free and confidential. The EAP also went digital last year, so just a reminder that you can now text the therapist as well. So if you'd like that opportunity, please call Resources for Living for the authorization and to find out more about the talkspace benefits. These are the mobile apps that can help you break down the barriers. So if you don't have all of these saved to an IQVIA folder in your phone, we encourage you to download these mobile apps so you have the insurance carriers in your pocket or at your fingertips at all times. So great news. We have some of the same great benefits that will remain in place from the brand partners that offer existing IQVIA plans. So Blue Cross Blue Shield, Optum, Aetna, Humana, and IMED will not be changing for the coming plan year. St. Paul's School offers the preferred PPO and the $4,000, $8,000 deductible plan. Again, these plans will not be changing for the coming plan year. So as outlined on the screen and reflected in your summary of benefits, these plans will continue forward. Just a reminder that the $4,000, $8,000 deductible PPO plan does provide the freedom for families with children. This plan provides a premium cost savings for healthy families with children, gives you the freedom to choose a plan that meets your needs, shop for prices, and visit providers of your choice. And an additional remark that we will make about the $4,000, $8,000 plan is it comes with a 0% increase for children and family tiers of coverage. So if you are looking to save a little bit of money, the $4,000, $8,000 plan could be a great opportunity for that. We just want to make sure that you understand the differences in this plan offering. The deductible and out-of-pocket are significantly higher than the preferred PPO. The co-insurance and co-pays are also higher. And while the plan premiums might be less, a catastrophic event might end up costing you more. But this plan also does offer the same great core benefits that do not apply to the deductible, same well-being incentives through Rally, and the same exact prescription drug plan. So it's really just important that you look at the plan and what your family will need this year when you're making your comparison and decision. The IQVIA prescription drug plan is not changing this year. We still have that same tiered approach or tiered structure. The thing that I will drive home on this slide is that we do offer 90-day supply within the retail avenue, like a CVS, Walgreens, or a local pharmacy, and the mail order is also available to you. Just keep in mind that a 90-day supply will save you money. We also have a lot of prescription drug freebies, so if you have a prescription from your doctor from one of the items listed on the left, these can be free to you. And we do have that additional out-of-pocket maximum that only applies to prescription drugs, just as a safety blanket for you in case you don't visit the doctor very often, but you do take a lot of medicine. The behavioral health and substance abuse benefits are not changing. These are still sponsored through the Aetna benefit. So if you're in need of professional counseling, psychiatric medication evaluation, ABA services, including autism, or those intensive services, that will be through the Aetna provider. Humana Dental remains the same. We're still offering the free dental plans, the high option PPO, the preventive low option, and that DHMO option. I will call your attention to the preventive low plan, and just to remind you that the preventive low plan only covers preventive and basic services. It does not cover major services such as a root canal or orthodontics. So if you do need some more extensive dental work, the preventive low plan is probably not for you this year. I will also caution you on the DHMO plan. This plan requires a network provider assignment in advance of seeking dental treatment, and it is also only available in the state of Florida. The iMed Vision plans remain the same. The base plan offers frames every 24 months with a $100 allowance for frames and contact lenses, and the buy-up plan offers frames every 12 months with a $130 allowance for frames and contact lenses. So just make sure that you know what you're getting into when you make the selection between base or buy-up. Legal Club is also offered to you through your institution, so if you have any questions about this, please contact your HR department. To close out, we just want to do some open enrollment housekeeping. Any changes made during open enrollment will remain in place for the April 1st, 2020 to March 31st, 2021 plan year. If you have any changes during, or if you need to make any changes outside of the open enrollment period, these are only permitted within 30 days of a qualified life event. So if you get married, or you have a baby, or you have a gain or loss of other coverage, items like that will open up a window to permit a change outside of the open enrollment period, but they must be completed within 30 days. Your 1095 tax form will be made available to you in your employee file. This tax form is not required again this year, so we'll just keep it for you in case you ever need it, ever need to reflect on it, or in the event that you're audited by the IRS. All other requirements of healthcare reform are in place. In fact, IQVIA plans offer more generous free wellness benefits that are required by law. So we really want you to seek out those wellness benefits as you see fit. Just to reiterate, now is the time to review and update your life insurance beneficiary information. And also, if you're interested in any of those new voluntary plan offerings, now is really the time to get in there and make those elections while you have the grace of the up to the guarantee issue amount with no medical questions. So thank you very much for your attention. We're really excited about this 18th year of continued service to our members, and we really look forward to servicing you this plan year. If you have any questions, please let your HR department know, or you can feel free to reach out to any of our brand partners at their contact information. Have a good day.